Alright, good afternoon everyone. Selamat tengah hari, selamat petang, dan selamat Hari Malaysia. Thank you very much for being with us today on a public holiday, for taking your time off your rest day to be with us on a very special discussion with Dr. Uma. Dr. Uma, thank you very much for being with us this afternoon.
No, thank you, Kenny. Thanks for inviting me, to share whatever knowledge, little knowledge that I have on suicide prevention.
Thank you. It's good to have you back again. Do you remember when was the last time you did a session for us?
Yeah, I think it was it a year ago? I think it was also the Suicide Prevention Month, right? And we had a session. That's right. Yeah, I remember.
That was in September last year, 1 year ago.
Agreed, Kenny. Yes.
Right.
Yes.
So before I proceed, maybe I'll just quickly give a short introduction of our speaker today, Dr. Uma. Yeah.
Okay.
Right. Okay. Dr. Uma Visvalingam is a consultant psychiatrist at the Department of Psychiatry and Mental Health Hospital Putrajaya. Okay. She's involved in several national and state level projects within the Ministry of Health Malaysia, including developing frameworks and guidelines, as well as training pertaining to mental health services in Malaysia. She actively gives talks for public and government agencies in various aspects of mental health, including stress management, suicide prevention, psychosocial response in disaster, and she strives to work with the community, including schools, to create awareness in promoting mental health and educating the community in prevention of mental health issues. Since stigma is a huge hurdle when dealing with mental health, she believes that by constructing interagency programs to create platforms for dialogues and open discussions, this can be addressed in a more holistic manner. And she's also a life member of Malaysian Psychiatric Association. So let us put our hands together to welcome Dr. Uma Visvalingam.
Thank you so much for the kind introduction, Kenny.
Thank you, Dr. Uma. How are you feeling today?
Okay, I'm feeling good. I'm really glad there are a few people who's joined in on a public holiday, and that too on a public holiday, right? So thank you for listening in, everyone. Thank you.
Thank you very much, Dr. Uma. So we are going to, this is going to be like a dialogue session. Prior to today's session, we have put out a form, to the public so that they can ask questions, direct any questions that they would like to ask, regarding suicide prevention or mental health issues, right? To begin, we will have a poll, of some questions that we would like to ask our participants today. Xuan, if you are able to, would you be able to share the poll? So thanks, Xuan. There are 4 questions there, so do go through the 4 questions. Ada 4 soalan dan tandakan sama ada ia adalah benar atau palsu, true or false. Okay. Can we end the poll and then maybe look at the results? Okay. So that's the results. Dr. Uma, boleh tak kita bincangkan soalan nombor 1?
Boleh.
Keadaan bunuh diri selalunya berlaku tanpa sebarang amaran. Kebanyakan daripada mereka telah menjawab bahawa ia adalah satu yang palsu. Jadi, Dr. Uma, macam mana ni? Untuk soalan 1.
Okay, selamat petang semua dan selamat Hari Malaysia. Okay, dan selamat menyambut bulan Pencegahan Bunuh Diri, ya. Actually sebenarnya jika kita balik kepada soalan 1 tu yang mengatakan bahawa kejadian bunuh diri itu berlaku tanpa amaran. Okay, actually sebenarnya kajian, ada beberapa kajian yang telah dibuat dan ia menunjukkan bahawa kebanyakan daripada kejadian bunuh diri itu berlaku dengan seseorang tu memberi amaran. Mungkin amaran tu secara lisan atau kita kata verbal atau secara tingkah laku, kata behavior lah. It's either verbal warning or a behavioral warning. So jawapan dia adalah palsu lah. Kemungkinan ahli keluarga atau kawan rapat seseorang tu mungkin tidak dapat mengenal pasti tanda-tanda amaran tu. So I rasa tujuan kita mengadakan webinar dengan just untuk meningkatkan kesedaran lah bahawa at least kita dapat mengenal pasti apakah tanda-tanda amaran yang kita boleh lihat pada seseorang yang ada kecenderungan untuk bunuh diri. Ya.
Okey, terima kasih doktor. Maknanya kita perlu ada pengetahuan tentang apakah tanda amaran apabila seseorang tu ada kecenderungan untuk membunuh diri, ya. Mungkin
Ya,
itu
betul.
akan merupakan satu soalan yang doktor boleh jawablah sebentar lagi, ya.
Okey, okey, boleh.
Okay, let's move on to all right. Well, let's move on to question number 2, doctor. Those who have suicidal thoughts are mentally ill. Most of our participants answered false.
Okay. Yes. Actually, Mr. Kenny, when we say mentally ill, yeah, there are several mental illnesses, that can be categorized in our diagnostic classification as, mental illness. But having suicidal thoughts, someone may just have fleeting suicidal thoughts at the point of crisis, a certain crisis in their lives. So that doesn't translate to someone having, just because we have mental suicidal thoughts, it translates you to having a certain mental illness. But like I will explain later, it could be a manifestation of an underlying, a bigger mental health issue that we deal with, so we cannot classify that. Someone who has suicidal thoughts, like it just could be, just a fleeting suicidal thought at that point in time. Okay.
Okay, and anyone can feel suicidal whenever they are, say, in a crisis.
That's
okay.
right. Yes.
Okay, yeah. Okay, soalan seterusnya bercakap mengenai bunuh diri amat berbahaya. Ia memberi idea untuk berbuat demikian.
Okay, alright. Okay, actually sebenarnya ada beberapa we call it studies atau kajian yang telah dibuat atas, because ada banyak kemusykilan tentang apabila kita nak bertanya dengan orang sama ada orang tu ada fikiran untuk mencederakan diri atau bunuh diri, dan kita takut pertanyaan kita akan mencetuskan idea untuk bunuh diri. Itu adalah tanggapan kita sebenarnya. It's a false perception. But in actual fact, our studies have shown that, kajian menunjukkan bahawa bila kita bertanya seseorang tu tentang fikiran untuk bunuh diri atau tindakan atau tindakan untuk bunuh diri atau mencederakan diri, ia sebenarnya mengurangkan risiko untuk seseorang tu mencederakan diri atau untuk bunuh diri, kerana pertanyaan kita atau cara kita connect dengan seseorang tu, ia boleh mewujudkan satu kesedaran yang membolehkan seseorang tu sedar bahawa rawatan tu wujud sebenarnya. So rawatan untuk fikiran untuk bunuh diri atau untuk kemurungan atau untuk keresahan atau untuk penyakit mental yang lain memang sedia ada. Jadi pertanyaan kita boleh mewujudkan atau meningkatkan kesedaran untuk seseorang tu untuk mendapatkan rawatan yang sepatutnya mereka dapatkan.
Maknanya kalau kita bercakap mengenai bunuh diri atau bertanya kepada seseorang itu, ia membantu.
Membantu.
Ya, membantu.
Yes.
Okay. Dan seterusnya, doktor, the danger of suicide has passed when a depressed or suicidal person begins to cheer up. So over 80% of them say it's false. Yeah, what do you think, doctor?
Yes, I'm so glad that everyone, 80% has said it's false. Okay, because suicidal ideas, it could be a manifestation or it could be a symptom of an underlying more extensive mental health issue, like depression or even bipolar disorder or anxiety disorders or panic disorders, right? So it could be a manifestation, and if someone cheers up momentarily, it does not mean that the underlying illness has also subsided, because an illness, when we talk about mental illness, any mental illness, it's just like any other medical illness. It's just like someone having diabetes or hypertension or high cholesterol. So we could put it in that category because it deals a lot with our hormones. It's just like how diabetes, hypertension, and gout. So when you say mental illness, we do not want to stigmatize mental illness. Right? So we want to put it as it's a medical illness per se, and there is treatment for it.
Mm-hmm. Yeah, I think, doctor, that another myth is that, people feel that if you have mental illness, you will have to live with it for the rest of your life, and you have to take medicine for the rest of your life.
Yeah, exactly. That's a totally wrong perception. There are certain illnesses that will need probably a longer treatment regime, or maybe a lifelong treatment regime. But if you have first episode of depression or some basic anxiety symptoms, which needs probably a short duration of treatment, depends on your current circumstances around you, current life stressors, life events. So all these actually depend on how long your treatment would be. But it's a misconception. It's a myth that they say if you take medication, you will be dependent on a psychiatric medication for the rest of your life. It depends. It's a case-to-case basis as well.
Okay. So what doctor has mentioned earlier is that, mental disorder can be treated, right?
Definitely be treated. Yeah. And this is what we are trying to put forward, that, please come and see us because it's so treatable. These illnesses are treatable.
Right. Talking about going to see a psychiatrist, right? Some of the feedback that we receive during, when people call us to talk about their problems is that they are so fearful, to even approach a doctor or go to a clinic kesehatan to see a doctor. What is your experience like, doctor, in Hospital Putrajaya, and you see a lot of patients, right? What would you say to them, those who are fearful, but they know that they want to seek help?
Okay. Actually, when they come, with that kind of fear or hesitation, that delays treatment actually, So when they do come, they would the first thing they would say is, they look at our signage saying, psychiatric clinic, and what am I doing here? I'm not mentally ill. Yes, a lot of them with just anxiety symptoms. We treat anxiety symptoms or even stress. Okay, not necessarily you have a psychiatric illness, but usually their complaint is that, okay, I'm afraid that if I tell you I have these symptoms, or if I tell you that I have ideas to hurt myself, or wanting to end my life, the doctor may not understand and may say that it will pass, or they would probably dismiss what I'm saying, and they won't take me seriously. It's happened before, because I've had patients who come in, they after 6-7 months of suffering with certain symptoms, they actually say that, for them, when they see the doctor, even at, I won't say clinic, I won't say that we are the best, but okay, we try to train as many doctors as possible to broach this subject, about, asking patients about suicidal tendencies, suicidal ideas, but there's always the hesitation because they feel that they would be judged. and they would be, in our culture, they would probably say, oh, you're not praying enough, you're not having a strong religious background, you just need to do this, okay, so they don't want to be judged. And that creates that fear and that creates the misconception.
Okay. So basically, I guess going to a psychiatric clinic, to see a doctor, shouldn't be as scary as people thought it to be.
Yeah, no. In fact, after they leave the clinic, they said, "I'm so glad I came." So yeah, so that it's just that we just have to correct their misperceptions of coming to a psychiatric clinic and coming to seek help. It's just seeking help. So actually, I know the stigma is very real, and that's why in our Mental Health Act 2001. We decided to come up with this thing called community mental health centers, so that we have mental health centers in the community, so it doesn't have the psychiatric label on it, so people can approach us at the community mental health centers without a referral letter. They can come in, they can do a screening, and they can get the initial treatment or advice or psychoeducation, and for further treatment. So that reduces the stigma, and we see the number of cases coming to us through our community mental centers have increased tremendously. In fact, calls as well. Some of them prefer to remain anonymous, right? And we do get calls, and we tell them, we guide them what to do with certain symptoms, what they need to do, and where they need to seek help.
Right. Thanks, Doctor. It would be interesting to know more about the community mental health center that you mentioned. Perhaps you can share with us later on, Doctor.
Of course.
But going back to what you mentioned earlier, that a lot of comments about people struggling with mental health issues is that you are not praying enough, things like that has to do with religion. So what is the connection between mental health and religion and suicide?
Okay. Actually, we can't disregard. Yes, I know, especially in our culture, right? Religion and suicide, in any religion, actually, suicide is forbidden. And when they bring it up to their elders, they would probably quash it and say that you need to do this, you need to pray more, okay, you need to read religious scriptures a little bit more to build up your I would say, I don't know the English term, but kuatkan iman lah, they always say, kuatkan iman. So your religious beliefs, you need to strengthen your religious beliefs so that you don't have these ideas. So that when we clamp down on that, we actually clamp down on them trying to express their suicidal ideas then. And what they will do is they will, say that, because of me not praying enough, I have this. But we cannot deny that spirituality has an important role in mental well-being, right? We cannot deny that. So whatever it is, if you have a mental illness, you have to seek treatment. Spirituality is one major component in the holistic treatment per se. So when we say, if they say that they are seeking alternative medicine, like seeing a religious person, for religious input or prayers, we encourage that, in fact. Okay, but we discourage seeing what do you call it, soothsayer, or a bomo lah. We always make sure, we will always ask them, are you seeing a proper religious person? And some of them will actually tell them, if they see a bomo, some of them will actually tell them, oh, please don't take medication. If you take medication, you will have these side effects, and you will be dependent on medication for the rest of your life. So we always counter, confirm with the patients. And if they say they're seeing a religious leader who just prays for them and gives them verses to read and, to strengthen their inner self, we encourage that. But we encourage that medication at that point in time. If we feel that they need to take medication, we will encourage that. So we have to, we need to acknowledge the important component of, we call it psychospirituality in the overall mental well-being.
Okay. So doctor, basically they complement each other lah, yeah.
Yes, definitely.
Okay, but it has to be done through the proper channel.
Proper channel, that's
Right.
right.
Okay. Thank you, Doctor. Okay, next question ya. Berbalik kepada soalan quiz tadi ya. Dr. Umar tadi ada katakan bahawa ramai kan daripada mereka yang sedang mengalami atau ada kecenderungan untuk membunuh diri. Mereka ada menunjukkan tanda amaran. Apa agaknya tanda amaran yang kita perlu beri perhatian?
Okay. Ada beberapa tanda amaran yang kita perlu tahulah. Tanda amaran secara lisan, which is called verbal warning signs, and also behavioral warning signs, tanda-tanda amaran secara tingkah laku lah. So verbal warning signs, if they express, okay, mungkin mereka meluahkan hasrat atau idea untuk bunuh diri. That is tanda amaran secara lisan. Dan tanda amaran secara tingkah laku, mungkin mereka menulis nota, okay, they start writing a suicidal note, or even in their blog, you can actually see that they are expressing hopelessness and intention to end their life, okay, and also we find that some people would also macam mereka akan mengagihkan harta mereka lah. So so that will be behavioral warning signs. Tapi yang tanda-tanda amaran yang lain yang kita dapati adalah mungkin tanda-tanda gejala-gejala kemurungan, menyendiri, okay, suka berkurung, tak nak berinteraksi dengan orang, okay, meluahkan rasa tiada harapan. Okay, so that is also one of the tanda-tanda amaran secara lisan. So there are a few tanda-tanda amaran yang kita perlu peka lah. Okay, so jika ahli keluarga kita atau kawan-kawan terdekat kita meluahkan atau menunjukkan tanda-tanda amaran kita, kita perlu tahu apakah tindakan kita seterusnya.
Okey, jadi memang ada tanda amaran yang kita boleh beri perhatian, dan sekiranya kalau kita dapati bahawa ada kenalan kawan atau ahli keluarga yang ada tanda amaran tersebut kan, apa yang perlu kita buat? Bagaimana boleh kita membantu mereka?
Okey, saya rasa langkah yang pertama adalah untuk bertanya. Okay, that's why they keep saying ask, do not be afraid to ask. Kerana bila kita bertanya, itu tak bermaksud ia akan mencetuskan tindakan membunuh diri atau idea-idea yang lebih kuat lagi untuk bunuh diri. Sebenarnya bila kita bertanya, dan cara kita bertanya jugalah, cara kita berinteraksi dengan ahli keluarga kita atau kawan-kawan kita yang meluahkan atau menunjukkan tanda-tanda amaran ni. Tapi bila kita berinteraksi dengan mereka, kita hendaklah menunjukkan empati. Jadi kita cuba memahami keadaan yang mereka berada pada masa itulah, okey. Dan janganlah kita meremehkan apabila mereka dah mula meluahkan idea-idea atau fikiran untuk bunuh diri. Janganlah meremehkan atau memperlekehkanlah apa yang mereka luahkan itu. Dan kita mungkin ada yang tidak pernah mendengar orang meluahkan kata-kata ini, so mungkin kita akan rasa terkejut, tapi jangan tunjukkan pada air muka kita, alright? So your facial expression, you have to be, we say poker face lah, right? Okay, do not show that you're shocked or do not show that you're embarrassed. Jangan menunjukkan kita rasa malu. Ketepikan ego kita, okay? Ketepikan ego kita dan bertanya dengan lebih lanjut lagi lah. Okay, apakah ada tak mereka ada plan untuk membunuh diri atau untuk mengakhiri hidup mereka. Dan juga janganlah, cara kita bertanya juga, janganlah menghakimi mereka. So we have to be non-judgmental when don't keep it in your mind, push away your beliefs, your other things, and listen with an open mind. If you put up a wall around you, that person is not going to be totally open, and we may miss the warning signs that we are actually looking out for.
Okay. Jadi amat penting sekali untuk bertanya, to have empathy, ada empathy,
Empathy.
mengambil serius tentang apa yang
Yep.
mereka sedang hadapi ya.
Betul.
Stay calm.
Yes,
Itu
stay
sesuatu
calm.
yang tak senang lah saya rasakan
Ya,
kalau
walaupun kita rasa terkejut,
hmm,
kita tak jangka orang tu boleh bersuara, meluahkan kata-kata itu, tapi janganlah tunjuk pada air muka kita. Okay? Dan
ya.
jika kita tidak tahu, langkah pertama adalah untuk bertanya.
Dan amat penting sekali apa yang doktor katakan ialah jangan menghakimi mereka dan menerima mereka seadanya, ya.
Seadanya. That's
That
right.
is, yeah.
So this is something that we have to always, time and time again, we remind even kita akan mengingatkan sesiapa yang kita kata gatekeepers lah, the frontliners, whoever is handling, support helplines, right? Do not judge them. So these are part of the training actually, being non-judgmental, right?
Right.
Yeah.
Yeah. Okay, and this, being non-judgmental is very much connected to our self-awareness as well, doctor, right?
Agreed. That's right. I totally agree with you, Kenny. Yeah, that's right. Because we have to change our perception. We have to switch our perception, our thinking, our values. Yeah, sometimes we tend to do this as therapists. This is one thing, this is one of the ground rules, the training that we do when we go through, that we do not, what do you call this? Put forward your values, your own values onto the patient. Right? You have your values, the person. So we have to take every individual as an individual.
I guess being respectful also important.
Very, yes, kita
Right.
kena menghormati orang.
Okay.
Yes, being respectful. That's right.
Thank you so much, Doctor, for the input. I'll move on to the next question. Yeah, this is related to the theme for this year's World Suicide Prevention Day, which is creating hope through action. How is hope or the feelings of hopelessness related to suicide? Yeah.
Okay. Actually, when we look at all studies, right? A lot of studies have done on the connection, the connection between suicide and hopelessness. Okay. Actually, hope is one of the key mediating factors in between depression and suicide. Actually, in fact, if someone is having depression or someone is having symptoms of depression and anxiety, they can have a sense of hopelessness, because their mood is so down, right? And they feel that the future is bleak. They feel so helpless and they feel hopeless. There is a strong connection between hopelessness and suicide. So when we talk about especially this year's theme, right? Creating hope. So we need to focus on hope as a method of suicide prevention. But there is a strong association. There's a causal link between hopelessness and suicide.
So meaning to say that people who are suicidal, most of them can have feelings of hopelessness. Yeah?
Yes, it could be one of the symptoms of depression per se.
Right. So since hope is so important in I guess suicide prevention, creating hope for them. How can we create hope for people who are struggling or who are feeling suicidal? How do we do that?
Okay, all right. Okay, it's not actually it seems okay, creating hope, it seems like how do I do that, right? What do I need to do? But the first step is actually showing that you care. Telling someone that you care and you're actually willing to listen, to spend some time to listen to them, So that actually, once you reach out and ask someone who's actually showing early warning signs or warning signs of suicide, reaching out to that person, asking them already translates to something saying that, okay, I care for you and I'm willing to spend some time listening to you. So giving them that space and giving them that time to listen actually creates a sense of connectedness, so when they feel connected, they feel there is hope. Okay, because at that point in time, if someone is so depressed and they are having strong suicidal ideas, they feel everything is their mind is like what we call berserabut, and they cannot see the way ahead. We do not give them solutions, but we actually guide them into finding the right path to treatment, to proper treatment. So it's the connectedness and reaching out to someone and showing them that you have the time and that space. You're giving them that space to actually talk about it, right? And that first step is already creating hope, showing that you care.
Right.
That's really important.
So this is actually very, very interesting, and I thought it's quite beautiful as well, because you create hope by being there for them, caring for them,
Yes.
and not sort of like solving the problems or giving them a solution, but guiding them instead.
That's right.
For example, knowing where they can seek help. That's how you can guide them, right?
That's right. Yeah, that's right.
All right. Okay, that's very interesting. I think that's something all of us can actually do, right?
Yes, and you don't need structured training for that. It's just telling yourself, it's so easy, to reach out to someone, reminding yourself if someone is asking for help, how do you reach out even if you don't have the solution for that person? How do you guide that person? How do you hold his hand and say that I will help you through this, I will try to help you through this, and I will guide you, and that's important.
Right. So I think this is where empathy comes into play, right?
Yes.
Put ourselves in the person's shoes, right?
Yes, that's right. That's totally right. Yeah. And it takes, I think empathy is an inherent thing that we all have actually, as human beings. I think we are born with empathy.
Right. I'm glad to hear that, Dr. Uma, because, sometimes people will tell us that, I don't think I have that empathy to become a volunteer, for example, with the Befrienders. But, maybe it's in there, but it's just that you have to look for it, right?
Yeah, you just have to dig deeper,
Okay. Right. We will move on to some questions that some of the members of the public have actually given.
Okay.
Let's move to the question. All right, this is quite long. These are actually two different questions, but they are very much related, so I put them together. I'll just quickly read them. Saya ingin berjumpa dengan pakar, tetapi saya takut. Saya tak tahu apa yang patut saya cakap pada doktor. Dan saya pun tidak tahu sama ada dia akan percaya atau apa yang saya akan ceritakan. Okay. And soalan yang seterusnya, saya sudah buat tes untuk lihat tahap depresi saya dan keputusan menunjukkan saya berada di situasi yang teruk. Tapi saya tidak pernah ke mana-mana hospital pakar kerana saya ragu akan ujian tersebut. Saya pernah pergi ke klinik berdekatan untuk menceritakan kesihatan mental saya untuk mendapatkan referral letter. Tetapi doktor di situ tidak mahu menolong saya, malah dia ketawakan saya kerana bersikap terlalu overreact hanya dengan ujian yang saya telah buat. Jadi saya hanya mampu pendam diri dan berpura-pura baik sehinggalah saya dapat lihat kesan fizikal yang berlaku ke atas diri saya, iaitu kurang selera, jadual waktu terganggu, saya juga cepat penat dan tidak bermotivasi dan selalu menangguhkan kerja, dan saya cepat serabut apabila orang trigger saya untuk siapkan sesuatu. Apakah nasihat doktor untuk masalah saya?
Okay. So kepada orang yang siapa tuan ke puan yang bangkitkan soalan ni, saya mengucapkan terima kasih lah kerana at least sudi nak bangkitkan soalan ni dekat platform ni, ya. Tapi sebelum saya bermula, saya ingin meminta maaf lah atas tindakan doktor yang mengetawakan tuan atau puan, encik atau puan, kerana sepatutnya kita tidak bolehlah meremehkan, macam saya katakan tadi, kita tidak boleh meremehkan gejala atau komplain yang kita utarakan. Cuma saya juga ingin nak elaborate sikit lah, tentang hak kita untuk ke klinik untuk mendapat rawatan. Itu adalah hak kita, and that is our basic right. If we feel that something is wrong with us, please go and seek treatment. No one can stop you from doing that. Tetapi mungkin apabila kita buat ujian itu, mungkin ujian itu adalah ujian DAS yang kita boleh dapat dekat internet jugalah. Dan jika ujian DAS tu, DAS 21 atau DAS 42 tu, ia merupakan satu ujian saringan. Dekat Pusat Kesihatan Mental Community kita pun kita akan menggunakan ujian DAS ini kepada sesiapa yang datang sebagai walk-in. So kita akan memberi ujian saringan ni, dan berdasarkan keputusan ujian ni, jika kita dapati ujian tu dikata ringan, semua ringan, kita akan memberikan psychoeducation, dan mungkin kita akan mengajar sedikit kita kata kemahiran daya tindak atau coping skills kepada sesiapa yang datang ke Pusat Kesihatan Mental Community kita lah. Tetapi jika ujian ni menunjukkan pada tahap yang teruk, ini perlu mendapat penilaian yang lebih terperinci. So jika doktor dekat klinik tu enggan untuk mendapatkan atau memberikan surat rujukan kepada encik atau puan, tolonglah datang ke Pusat Kesihatan Mental Community yang berdekatan, yang tidak memerlukan surat rujukan dari mana-mana. Jadi encik atau puan boleh je datang. Nanti saya akan minta Encik Kenny untuk tunjukkan dekat mana kita boleh mengakses kepada perkhidmatan kesihatan mental yang terdekat di Pusat Kesihatan Mental Community. Kita akan berikan nombor telefon, dan mungkin encik atau puan bolehlah datang ke klinik kami untuk mendapatkan rawatan seterusnya. Dan jangan ragu-ragu, kerana kita tidak akan, seperti mana yang saya beritahu tadi, kita tidak akan menghakimi sesiapa yang datang. Walaupun kita rasa, puan rasa, ini adalah mungkin saya tak serius kot. Tapi biar doktor tu yang membuat penilaian. So kemungkinan kita akan mendapati bahawa mungkin puan, tapi daripada simptom yang puan beritahu tadi, encik atau puan beritahu tadi, ini adalah simptom-simptom yang menunjukkan kemungkinan encik atau puan ada masalah kemurungan atau keresahan yang teruk.
Terima kasih Dr. Uma. Jadi amat penting sekali tuan atau puan ini untuk tidak give up lah, supaya
jangan
cuba lagi.
That's our basic right. Itu adalah hak kita. So yes, to seek treatment.
Itu amat penting sekali ya. Tak pun saya terfikir bahawa itu adalah hak kita untuk mendapatkan rawatan.
Ya, betul. Jadi jangan, jika kita dapat satu pintu tertutup tu, jangan kita berputus asa. Kita cari jugalah jalan lain, kerana ada banyak pilihan, dan nanti kita akan paparkanlah apakah talian-talian sokongan yang sedia ada, dekat mana yang kita boleh dapat rawatan, ya.
Sebab mungkin satu doktor tu dia tak faham, tapi ada ramai lagi doktor yang sebab saya pun pernah berjumpa dengan ramai psikiatris yang memang orang baik-baik lah. So don't give up lah, ya.
Yes, that's right. Don't give up.
Right. Thank you, doctor. We'll move on to the next question. All right. This question here, I was diagnosed as overdose. I don't really know how to pronounce this.
Escitalopram, it's an antidepressant.
On 12th of September 2021, that's just a few days ago, doctor.
Yes, that's right.
I am a nursing student, and I'm so sad that most of the doctors dare question my capability of becoming a nurse just because I have a record of suicide attempt. They say that I'm not quite rational to be a nurse. All those words make me feel so invalid, and I have to brush it off with a simple laugh. So the question to you, doctor, is: Am I not suitable to be in health profession if I have depression?
Okay, it's really brave of you to come up with this question to us. And I know I can imagine that it's not difficult, but it's not easy going through this, because looking at what you're saying is you're not getting the adequate support that you need, okay, at your workplace. But do you know that there are a lot of professions, okay, a lot of professionals, even in the health profession, who has depression, okay, depression and other mental illnesses. If they are treated well and they are in remission, you can continue working in this health profession, okay. So the thing is, you are already on escitalopram, and that's an antidepressant. So it could be, I probably guess that you are probably having depression or anxiety, okay, to start off with. And it's not that probably you have not achieved remission of symptoms, so you're still symptomatic, and you may have gone through a crisis, a life event or a crisis, and that point in time that you felt there was no hope, and it could, I'm just guessing that this could happen, this probably happened to you. But I hope that you realize that depression and anxiety, we can treat depression and anxiety effectively with so many medications in the market. There are new medications with less side effects in the pipeline, so you can always come forward and seek the appropriate treatment, even though people around you judge you and say that, okay, because you have this, you cannot be someone in the health profession. But please disregard what they say, because like I said, from my experience, I know many who are successful in the health profession, and they have had history of depression, okay, or bipolar, or even anxiety, okay. The main thing is, what I'm trying to put forth is, the main thing is you have to get appropriate treatment. Medication has to be tailored, okay, has to be optimized so that you achieve remission of symptoms, okay. So I think that's the most important thing: going for proper treatment, being compliant to your treatment, and being honest with your doctor or with your psychiatrist.
Right. So doctor, what is important here is to basically focus on the recovery first.
Yes, that's the most important thing. So at that point in time, even we feel, okay, I don't think I can go on like this. I don't think I can become a nurse. But do not make any rash decisions, okay? And don't be influenced by what people say around us. The first thing is getting treated first, and moving towards recovery. That's the most important thing.
Okay, thank you so much, doctor. I think, you mentioned earlier that you want to sort of like show us where we can get help for mental health issues. So maybe, doctor, you can maybe guide us.
Okay. Maybe we can just share that slide. These are some infographics from Ministry of Health. And they have come up with, where you can actually access help. Okay, we have, if someone comes and someone does a screening test online, or, if they come to our, that's right, where to get help. So these are the list of government and private healthcare facilities where you can access mental health care. Okay, so, there are several ways of how, if you feel that, you feel that you are having some symptoms of depression or anxiety or even stress, and there is also an online screening tool, like I mentioned, DAS 21. You can access it online. If you feel you've done this, you can actually take the results of this test, and you can actually go to a health clinic, primary healthcare clinic or a clinic kesihatan, the nearest clinic kesihatan. So you can see there's a website, there's a link there where you can see the list of clinic kesihatans, and try to find a clinic kesihatan which is accessible and within your locality, and bring the results, or even if you don't have a printed results, you can go and see the doctor there. But before that, since the COVID pandemic started, we can't just walk into a clinic kesihatan. So I have to remind everyone that we have to make an appointment. So I think if Kenny, we can just show the, what do you call this, My Sejahtera app. I think it's the following slide, the next one. Yeah, sorry. Yes, that's right. So this is our My Sejahtera app. And there's this icon called digital health. The next slide, please. Yeah, okay, you have this. Once you click the digital healthcare, there's a clinic appointment booking, because many clinics do not entertain walk-ins right now because they limit the number of patients because of the current pandemic. So if you can access this digital healthcare to the My Sejahtera and click on the clinic appointment booking. So when you click on the clinic appointment bookings, if I'm not mistaken, yes, that's right. So there is the QMed, on-call med, book dot, and then system Janji Temu Clinic KKM. So if you can click on either one of it and you find the nearest clinic, and you can actually book a slot on using this My Sejahtera app. And then you can walk in and say that you show them that you already have an appointment. So this is something that I have to inform everyone, because we do not, now most of the clinic kesihatan do not entertain walk-ins. So for the time being, right? And then going back to the other slides, okay? So you can actually access mental health care at clinic kesehatans, okay? And also you can come to the government hospitals. Any government hospitals, they have psychiatric clinic, okay? And they have psychiatric services, psychiatric and mental health services. But when you come to the hospital, you may need a referral letter. For clinic kesihatan, you can just make the appointment and go and see the doctor there. But when you come to a psychiatric clinic at the hospitals, you may need a referral letter, which you can actually get from the clinic kesihatan, all right, or from a private practitioner, right? And that is one way. And the other thing, the other option that we have is the Pusat Kesihatan Mental Community, or Mentaris. So in this, in fact, we have a link for you to access the Mentaris around Malaysia in all the states. So wherever you are, you can access the nearest Mentari to you. And for Mentari, you do not need a referral letter to come in. And once you come in, depending on the severity of your screening, we will decide whether you need immediate treatment, or you will be given an appointment to see the doctor or to see the psychiatric doctor. All right. So at Ministry of Education, under Ministry of Education, you have the university hospitals. So you have the University Malaya, or PPUM, you have PPUKM, UITM, and also USM. And currently we have HPUPM, that's UPM in Serdang. Okay, so these are the list of university hospitals that you can access mental health services. Okay, all right. And if we can move on to the next slide.
Dr. Uma, can I just check with you, yeah?
Sure.
For Pusat Mentari, is there a need to make appointment now that pandemic?
No, even the pandemic, we actually entertain walk-ins.
Okay.
So if there's walk-ins, we will do the screening, we do a DAS screening, and depending on the severity, we will give the appointment.
Right. Thank you, doctor.
All right, and I also have to inform that, Ministry of Health has come up with this Talian Sokongan Psychosocial, and this materialized during the COVID pandemic. This was in March, they came up with this. So it's meant by psychology, counselors, psychologists, and also volunteers for Mercy. So this is a collaboration with Mercy Malaysia. And you can access if you have any issues, you need advice, you need help, you can call in. And this operational hours are between 8 a.m. and 5 p.m. So this is collaboration between Ministry of Health Malaysia and also Mercy Malaysia, right? And we also have another helpline by the Ministry of what do you call it? Women, right? Women and Family and Community Development. Okay, so this is called Talian Prihatin Malaysia, or earlier we used to call it Talian Nur, and now they call it Talian Kasih. So they offer counseling, and if you have identified, if someone, you know, someone is being abused or there's neglect, you can always call this Talian Kasih at 15999 and inform them, and they would take action from there. Okay, all right. And I think the next helpline is, yes, that's right. Okay, this is the MHPSS, the similar one. It's called, actually, there's a program called Let's Talk Minda Sehat. Okay, also by Ministry of Health, where they encourage people to talk. Okay, so the talk is an acronym actually. It's tell someone you trust about your problems. A, ask for help. L, listen without judgment, and K is know where to seek help. So these are the QR codes for Talian MHPSS state MHPSS lines, list of psychiatric services, list of clinic kesihatan, and also list of NGOs who provide mental health and psychosocial services. All right.
This is actually very
yep.
good, Dr. Uma, with the QR code, yeah, has the list for almost anything that we would need for mental health. Yeah.
Agreed.
So
yes. Yeah.
if you
and
guys
even
want,
going back,
right.
yeah, you can put it up on your website, and you know, and the other thing is the easiest to access is your My Sejahtera, because I think if you go, going back for I mean, just go back a few more slides. Sorry, Kenny. Back to the digital health. Okay, the next one, there's another icon called Minda Sehat. Okay, so when you click digital health here, this is a new icon. Okay, and this was also the brainchild of Ministry of Health, where they put it in, and they put in as Let's Talk. Okay, so the Minda Sehat, if you click on the Minda Sehat, if you go 2 more slides ahead, Kenny, please. Yes, that's right. So we have accesses. So you have the emotional support hotline, you have the psychosocial support hotline, mental health information, and also there's a self-screening assessment. So this self-screening assessment, okay, don't worry, I've done this also. I've tried it out myself. It's just 2 questions, but they're going to ask you about your name, your, you know, where you're working, right? Okay, so don't worry. All this information is confidential, but the most important thing is your self-screening. If you find that you answered, there are 2 questions. Okay, it's called the Woolies question, where one of the questions actually asks you about, low mood, and the other one asks you about whether you have any loss of interest. Okay, so if you answer yes to either one question, then you know that you need to seek further help or further assessment is required. Okay. All right, so this is very important because this is fairly new. So we would like everyone to know that this is available at your fingertips.
Yeah, it's really helpful, Dr. Uma. As you are talking, I'm like clicking on my Sejahtera,
yes.
and it's really very helpful, I think.
Agreed. Yes, that's right.
Yeah.
That's right.
Yeah. All right. I would like to ask participants if any one of you have any question for Dr. Uma, because we only have about 4 minutes left.
Oh, okay.
For those of you,
sorry, Kenny. There's someone who asked for a person who has a huge debt, right?
Okay.
So usually, usually someone with huge debt, they would come in a financial crisis, and we see a lot of them, especially in this current situation right now, where there are loss of jobs and economic downturn. It's very difficult for a lot of people. Okay, so when they come in with huge debts, we actually guide them. If we feel that they can get additional advice, if they come to the hospital, we could refer them to, we call it a medical social welfare officer. Okay, maybe the medical social welfare officer could guide them on whatever help that's available, right? And if someone is an OKU card holder, so they can be, they are entitled to certain benefits from the government as well. Okay, so if we can also suggest them to probably link with AKPK, right? Who will, that's an agency that, helps you with debt management. Okay, so these are things we actually guide them. Like I said, we don't have solutions, but we try to guide you to whatever available, help that we can access. You can access.
Right. So thank you, Doctor, for that. Any more questions from the participants? You can either type it in the chat box, or if you want to use the mic, that's okay also better, yeah?
Yep,
Because we're running
right.
out of time. While waiting for question, maybe I'd like to ask Doctor also, how do you, take care of your own mental health during this pandemic?
Self-care, yes, Kenny. Self-care is so important. I think a lot of us neglect that, sometimes we get burnt out just doing our job, right? And we tend to always put people ahead of us, right? And what we need to do is the basic things. Always tell people is just make sure your lifestyle, we call it gaya hidup yang sehat lah, okay? So the basic foundation of a healthy, to ensure healthy, kita kata kesejahteraan, kesihatan mental kan, okay? To ensure a healthy mental well-being, basic things are your sleep, your appetite, okay, your dietary intake, and physical activity, and that is the foundation of a mental well-being, right? So okay, hey, hi Anis. Okay, and what do you call this? So we have to ensure that you have adequate sleep, you have well-balanced diet, and physical activity. I'm not saying, I know studies have shown that you need 20 minutes of exercise every day, or 3 times a week. I think not many of us, even myself, I don't think I can commit to 20 minutes of exercise, physical activities every day, right? Because, it's something we have to have realistic goals, okay? Bottom line is being realistic with your goals, right? So what I encourage people to do is have exercise snacks in between. So if you're working, right? If you're working, especially during this pandemic, or you're working from home, have exercise snacks, meaning you just have, while working, maybe every hour, you just do 2-3 minutes of, sit-ups or jumping jacks, or, something simple, right? 2-3 minutes. At the end of the day, this would amount to 20 minutes of exercise or even more, okay, or physical activity per day. So the basic main foundation, we have to strengthen that foundation of having, at least 6 to 7 hours of sleep. They recommend 7 to 8 hours of sleep. Even I don't have that. Okay, but so, and make sure you have your proper meals, well-balanced meals. Okay, and make sure your timing for your meals is appropriate. Don't just try to eat in between. Self-care is so important. It's just like, the analogy of, if the pressure in the plane, your cabin, your flight, you're taking a flight, and suddenly the cabin pressure drops and your oxygen mask drop, and you are traveling with a child, you put on your oxygen mask first before you tend to your child. So we need to actually look after ourselves before we can actually help other people. So that's really, really important.
Thank you for the tips, Doctor. Yeah, there's I think one question. I think we can take one last question from the participant, from Xuan. Yeah, Xuan. Hi, Xuan. Hi there. May I ask, can the public access any mental health social worker to have someone to follow up with their journey of to getting intervention?
Right. Mental health social workers, to date, we do not have a dedicated social worker in mental health services. Usually, even in the hospital, it comes under the administration. Okay, so we do not have a dedicated social worker. We are trying to get that. But any social workers, if we can actually access our welfare department, if you come to the hospital, we will refer to the medical social worker, right? Or we call it a MSW. Okay, and they will actually guide you to whatever social services that they have out there, right? So we have a lot of NGOs. We have our JKM to start off with. They have even Baitul Mal. You can actually access Pusat Zakat for even financial aid, right? So these are things that the social worker can actually guide someone to access social services, and to have someone to follow up with their journey to getting intervention. All right. Okay. Basically, if we have this access, we have the phone lines, the QR codes. You can actually access the clinic kesehatans, the health clinics, and also hospitals. And some of the clinic kesehatans, they have their in-house social workers. So they can actually guide you into getting the appropriate social aid that we need. Okay, I hope that answers your question, Xuan.
Thank you, Dr. Uma.
Thank you.
Okay, Xuan says it does.
Thank you.
Yeah.
Okay.
So I think we are at the end of the session today, Dr. Uma. But before we let you go, right? Ada tak apa-apa kata akhir atau pesanan dari Dr. Uma untuk?
Okay. Alright. Okay. Especially Sempena Bulan Pencegahan Bunuh Diri 2021. Saya ingin mengingatkan semua bahawa mencegah atau pencegahan bunuh diri adalah tanggungjawab bersama. Okay, bukanlah para profesional sahaja, tanggungjawab bersama. Dan jika kita mengetahui jika seseorang tu ada kecenderungan untuk membunuh diri atau ada niat untuk membunuh diri, luangkanlah masa untuk mendengar. Okay, luangkan masa untuk membantu atau we call it guide them, okay, untuk mendapatkan bantuan yang sepatutnya atau sokongan yang mereka perlukan. Kerana setiap tindakan anda adalah sangat penting untuk seseorang tu yang menghadapi krisis atau tekanan hidup dan yang mempunyai kecenderungan untuk bunuh diri, kerana every life matters, every life is important. So even if you spend 5 minutes with someone just to listen, it would make a difference for that person. Okay.
Thank you, Doctor. I think that's so meaningful, right? To basically, everyone has a role to play in suicide prevention, and like what you said, 5 minit pun akan membantu, yeah?
Exactly, that's right. Just 5 minutes,
Right. Thank you so much for your time, Dr. Uma. Terima kasih.
Thank you so much. Thank you so much, everyone, for listening. Thank you, Kenny, being a fantastic moderator.
Thank you. I really personally enjoy, all the session with Dr. Uma because it's so insightful. There's so much information, helpful information, right? So we hope to do this again in the near future, Doctor.
Thank you, Kenny. Kenny, you always make me feel at ease, so I forget myself. Thank you. Thank you, everyone, for listening in. Thank you. Until we meet again.
Right. Take care, everyone.
Take care.
Do go and follow our social media. We are on Facebook, Twitter, and also on Instagram. So maybe we'll just also share this QR code on our social media as well as our website. Thank you very much, guys.
Thank you. Thank you, everyone. Bye-bye. Thank you, Kenny.
Thanks.